Hello, welcome viewers to another episode of Optimum Health Solutions. Today, we are talking about in vitro fertilization, and we have with us as a special guest Professor John Ikimalo. You have met him before, but today we are going to concentrate on in vitro fertilization. Prof, you are welcome.
Thank you very much.
Okay, so let's start with this question. What are the indications for IVF?
Yeah, the reason why people should do IVF is basically for women who have infertility and have been investigated and found to have the need for the IVF. And the need for the IVF can be because the reason for not getting pregnant can be in the woman or in the man. In the woman, the commonest reason why IVF even came up at all was because of blocked tubes. So when the woman's tubes are blocked, she will need an IVF. Other reasons in the woman why you will need an IVF is when the woman has abnormalities of her genital tract or have had surgeries. For instance, she has had surgery to remove her ovary or to remove her uterus, or when there are abnormalities of the genital tract, like not having ovary, not having uterus, or the uterus is smallish and is not well developed. And then other reasons may include the fact that she has hormonal problems that are making it difficult for her to achieve a pregnancy. These are some of the common reasons in the women. But in the men, if their sperm count is low and is very low, sometimes even no sperm that is produced, though the sperm might be produced, but there is blockage, and then we need to get the sperm from the testes to do IVF. These are some of the common reasons why we do IVF. Okay. Also, sometimes in the women, if they are not ovulating at all, if the ovary has stopped responding
Production
to the
of eggs.
Production of eggs, yes.
So you don't have to get eggs from somebody
these are
else.
the reasons for IVF.
Okay, for now, how effective is IVF by way of achieving pregnancy?
Yes, well, the IVF in itself means that the sperm and the eggs cannot naturally meet in the genital tract and form pregnancy. So what IVF means is taking the woman's egg out, then taking the man's sperm, putting them together and achieving a fertilization, and then putting it through the vagina and cervical canal into the uterus, which is the womb, for that pregnancy to stay for 9 months. Okay. So the question you now ask is, what is the success rate?
Success rate.
The success rate, ranges between, when we talk about success, success of achieving pregnancy is one, then success of taking home a baby, which is the ultimate aim of such women who want to get pregnant. So these days, we like to talk about take-home baby, as a success rate.
Not just
achieving the pregnancy. Okay. So the success of taking home baby is usually between 20 and 30. Success of achieving pregnancy is about 20 to 40%, but take-home baby rate might be lower than that, about 20 to 30%. And that is because there are other issues that the woman may have. If she's hypertensive, if she has any other problem.
Diabetes, for example.
Diabetes, hypertension, and all that, yes.
Okay. Now, I hear there are different types of IVF. What are the types that we commonly use?
Yes, we always put all of them as IVF, or even a broader term is to say assisted reproductive technology. But sometimes people just group them into 3 groups. One is intrauterine insemination, in which it is not so elaborate. When the sperm is slightly low, the woman has no issues. Not necessarily, she doesn't have blocked tubes. Then we can take the sperm and treat it and then put it into the uterine cavity, and then the woman may get pregnant. That is not really elaborate. That is cheaper.
Is that what they call natural IVF?
I don't know where they call it natural IVF, you
or
know.
not? Because it's almost like
But
the
then,
natural way
it,
of achieving pregnancy.
yes, it's just that there is no sexual intercourse,
Of course.
right? Okay, then the other one again too is sometimes people describe a way where you use the natural cycle. That is, you don't have to give the woman drugs to get more eggs, and then you also take her eggs and take the sperm, put them together. But in that case, you are just using maybe one egg if you succeed at all. Then there is also the IVF where you stimulate the woman to get more eggs, and then you will take the man's sperm and put them together in a petri dish, and then when you achieve pregnancy, you now transfer, into the woman's womb. Then there is another the one in which, because the sperm count is very low, or you had to get the sperm by aspirating the sperm from the testes, you have to do what we call intracytoplasmic sperm injection, in which you actually take one's sperm and inject it into one egg. And
So
so
just
if you
a
have five eggs,
span,
yes,
yes.
you inject one sperm into one egg, and then to achieve pregnancy. Those are the various
So
types
that
of
one is just a
IVF.
direct injection.
Yeah, direct injection. But
Okay, so make sure that
the
it
sperm actually,
doesn't miss.
yeah, the sperm actually penetrates the egg
By
to
itself.
achieve fertilization.
Yes, yes.
But technology has gone to that level where we can actually take that one sperm and then inject it into the egg
So the so
and
that
achieve
just as per
fertilization.
achieve
Yes, achieve
fertilization.
fertilization.
Okay, so these are modalities. Now, what what happens next? Assuming the woman achieves a pregnancy, how do you now look after that woman? I'm sure it varies from woman to woman.
Yes, well,
From then on,
if once a pregnancy is achieved, the first thing is that we do a pregnancy test, and everybody is happy. And then 2 weeks after then, we do a scan. And when we do a scan and we see a fetus inside the sac or in the uterus, that is when we're actually happy that, oh, this is an established pregnancy. Because sometimes you can have what we call a chemical pregnancy, in which you have a positive pregnancy test, but there's no physical pregnancy, as it were. So it is after the scan that we're happy, usually at about 6 to 8 weeks, that
that
we see that
pregnancy has been
fetus
established.
established. And then um, looking after the pregnancy is just like any other looking after any other pregnancy.
Pregnancy, except there's a
Yes,
precious baby.
yeah, it's a precious baby, but the only thing is that initially when IVF started, in fact, the pregnancy is looked after like any other pregnancy. Register for antenatal, do your regular antenatal care. When it comes to delivery, that before now, people tend to say because it is precious pregnancy, cesarean section was being offered
Yes.
all the time. But that's the notion has changed now.
Okay.
The patient can be managed like every other patient.
Okay.
But in saying that, for example, if the woman is advanced in age, even with natural pregnancy, we're a little bit cautious. If you are going to allow labor at all, some of them, obviously, you do a cesarean section. But
Okay.
for some of them, if you want to allow labor, or for some people, for one reason or another, you might decide to induce before. Those are,
Okay.
the delivery method and management is depends on a lot of things, the history, and then the history of the pregnancy during antenatal, and then what is happening at that moment. For example, if a woman has had IVF and then you've gotten to 37, 38 weeks and her blood pressure is shooting up, you need to take
Yeah.
steps to the
Postmenopausal women, can they be offered IVF?
Yes, of course. Postmenopausal women means women who have stopped menstruation.
Yes.
Yes, they can be offered IVF because the uterus is there, but the thing is that it is not likely that their eggs are going to be used. So it's likely that they will most likely
Get eggs from somewhere.
get egg donation. Yes, but then there are ethical issues. With IVF there are ethical issues. When you say postmenopausal women, at what age do you want to peg that?
Okay.
You know, some people say 55 years, some say 50 years.
60.
But if a woman is 60 years old, because you get in the paper sometimes, some of our colleagues still go ahead to try and get a woman to do IVF at 60, 65, and all that. Yeah, but then the moral issue is if you have a baby at 65, how long are you going to live to
Born
look
with
after
the baby.
So there are issues with the raising of such a child,
Okay.
and is it fair on the child?
And all the
And
hormonal
so that's
treatment
why
and so on.
that's a different topic, a big topic. Yeah.
Okay. Now, the I think so it's very clear now what IVF is for, the types of IVF that is possible, how the woman is looked after, and so on. What advice will you give women, who are wishing to have babies through IVF? For example, would they be hopeful, or do you think that IVF will solve their problems?
Yeah, of course. With IVF and assisted reproductive technology, it has given hope to the hopeless.
Okay.
Because before then we were stuck in medical practice as to some of the women who had blocked tubes. What do you do with them and all that? But IVF has changed a lot of things. Even people who didn't have uterus, people who have cancer, they want to preserve and then they are treated for cancer. They don't want to get pregnant or carry a pregnancy thereafter. So a lot has changed with
The
the
hope is
introduction
there.
of assisted reproductive
Okay.
technology.
But
So the problem now is that the success rate.
yes,
Success rate.
again.
So the success rate is the issue, and then the success rate, like I've told you, between 20, 40%, depending on age and depending on a lot of factors. So people should be hopeful. I think that when people are going to do IVF, so with what I've said now, there are more failures than success. So, but the more you repeat it, the more likely that you get pregnant.
Chances of
Chances of getting pregnant. So really, you should be hopeful. You should be hopeful. There are many cases in which first pregnancy you have twins, sometimes triplets. But we don't like triplets. We don't like.
because they are difficult to handle.
Yeah, because
manage,
the risk
so
to the woman is right.
yeah.
So when there are higher order pregnancies, I think singleton pregnancy is what we like.
Okay.
Preferably, but at least in Africa and in Nigeria, we don't mind twins. Okay. Because we have a high prevalence of twins.
At least the southwest of Nigeria.
So really, there is hope. There's a lot of hope. The thing we find in practice is that sometimes when these patients are not well counseled or motivated, they think that because Mrs. A had success in her first, they too must have success in their first. And then, but life doesn't go like that.
Yes, no, so that is not always.
You'll be surprised that
they say in Nigeria.
Yes.
Life non-balance.
Yes, so hope. There should be hope. There's a lot of hope, and that is why there is a lot of psychological trauma to failures, and that's why we have counselors.
I wanted to ask you, how do you break the news?
Yes, we know
either a failure news or a success news.
Yes, both of them. Yes, so we use counselors, and then the doctors. Of course, the doctors, they know more, but the doctors will try and break the news to them, and then the counselors can follow up. For some of them, even when once they've had the first cycle and there is failure, to come and do a second cycle becomes very difficult.
There's trepidation.
Yes.
And so on.
So I'm here to say that they should not lose hope. They shouldn't lose hope because we've had people who have done IVF 4 times, 5 times, 6 times. I have a personal experience. My niece, it was the 6th time she had twins.
Okay.
She had twins. So it's sometimes the cost is much, but as much as possible.
There is light at the end of the tunnel.
Oh, definitely, there's light at the tunnel. Definitely.
Now, I want to talk about some disturbing issues of abuse of IVF or abuse of patients that seek IVF. Are you aware of any such things, that news going around, rumors that some doctors misuse the position of they are misuse their position in looking after these women?
Um, uh, Specifically, what do you mean
What I
by
mean is,
abuse
for
of,
example,
you know,
if you
you
get,
talk
say,
about the
let's say you are looking for
unethical issues?
unethical issues. For example, apart from general unethical issues, which every doctor takes should be careful about, there are certain issues which is even global, where people go take, let's say you need one egg, they take like 10 eggs, and then the others are wasted. Or you have multiple embryos that have developed and are growing, and then let's say they need just maybe one or two to insert in the lady, and they throw away all the other embryos. People, human rights activists say that that is not being fair, that you are, those are lives that you are wasting.
Well, thank you very much. The issue about what you do with excess embryo, that's why I'm saying that those are ethical issues.
Mhm.
Because if a woman has 5 embryos, for instance, and then you put in 2 or 1, what does she do with the rest of the embryo? You ask her, because embryos are stored now,
Mhm.
and then if she can't store the embryo, but they have to be paid for,
Yes.
and then we encourage them to store their embryos, because if they store the embryos, then they don't need to be stimulated again and start the whole
So they
process.
can,
So they
next
can
time
do
they can use
frozen
one
embryo
of the
transfer. Yes,
frozen
yes, they
embryos.
can use
Okay.
frozen embryo
Can they
transfer.
donate those embryos to other people?
Well, those things should be discussed ab initio. It's not just to come and say, "Okay, I want to donate my embryo to this person," because there are various schemes that are done. There's even what is called embryo sharing, where a woman who is rich, is and then a woman who is poor, the
Okay.
rich can now, yes, those are discussed ab initio.
So it's
And that's what, yes.
it's something that has been discussed,
Yes,
understood,
yes, understood, and
and
then consent,
has been
written
written
consent taken.
consent has been
Yes,
taken.
yes,
So it's purely an ethical issue.
yes, very analytical. Those things
Okay.
should be discussed before.
Thank you very much, Professor Ikimalo. I think we have gained a lot today, and on the topic of in vitro fertilization. Thank you very much for coming,
Thank you
and
very much.
particularly delighted that you came and you are here and you have explained this rather complex. No, not everybody knows about IVF, assisted reproduction, and so on. I think you have explained it to the point that most of us will understand what it's all about. Thank you.
Thank
I
you very
hope you
much.
will come
Thank
again
you.
next
Thank
time.
you for having me.
Thank
Yes,
you
yes,
very
thank
much.
you.
Viewers, please, that's the program we have for today. Like, share, most importantly, subscribe. Bye for now.